Welcome to the 8th and final day of the Division of Workers' Compensation Healthcare Provider Spring Boot Camp Series. You made it to the end of this obstacle course. The last time you built your agility and your muscles navigating the climbing wall of certified workers' compensation healthcare networks, and now we're headed to the recovery tent. And today we're going to offer you some shade, some hydration where you can recover, reflect on your hard work, and make sure that you get rewarded for successfully conducting and correctly billing for your workers' compensation certifying exams. Our learning objectives today are going to be to recognize current billing requirements and reimbursement values, and apply billing instructions to examples by each doctor role for these certifying exams. This presentation is updated as of today, March 19th, 2026. It is for educational purposes only, but the responsibility of following our laws, the Texas Insurance Code, the Texas Labor Code, as well as our rules that are in the Texas Administrative Code lies with you. So if there's ever a discrepancy or a dispute about what was presented today, it's going to be resolved based on the language in the rules and the statutes. So for an overview, we're going to be looking at the rules and introduced to the current reimbursement values for workers' compensation, specific exams, the billing requirements for designated doctors and other certifying doctors. And then we're going to go through billing instructions and examples of bills for each type of doctor role, including, of course, our designated doctors, required medical exam doctors, treating doctors, and referral doctors who do maximum medical improvement and impairment ratings. And then also, I'm going to provide you with some resources that'll help you move forward. So you can find the Texas Administrative Code on our rules, on the TDI Workers' Compensation website. It's going to be, if you look in the Workers' Compensation A through Z, go to R for rules. Also, you could refer to that navigating DWC document that you received in your login instructions. So the first section that is super important and applies is going to be Chapter 133. It's a good idea to have your billing staff become familiar with Chapter 133 because it's going to outline all of the general medical provisions, your time frames, how to fill out your bills to complete that bill. Next, Chapter 134, specifically 134.210 is going to outline the fees that are adjusted annually by applying the MEI adjustment factor. It stands for Medicare Economic Index adjustment factor, and it's going to have all of your modifiers for workers' compensation specific services that you'll need to include on your bill. And then next, in Chapter 134, each doctor role is going to have its own rule for the maximum medical improvement and impairment rating exams that they do. So 134.235 is a rule for RMEs, or required medical exams. And then 134.239 has one job, and it addresses how you are not allowed to bill for work status reports separately if they're completed as part of an ordered exam. So think about those exams ordered for designated doctors and RME doctors. And then you have the designated doctor, treating doctor, referral doctor rules in 134.250. And then 134.260 is going to be your treating doctor rules for these certified exams. So just remember that each doctor role has their own rule. And when you put on these different hats as we move forward, just keep that in mind. So continuing, we'll get into some general information and definitions. And you'll hear the terms, often hear us saying authorized doctor or saying certified doctor. So authorized, sometimes interchanged with certified. Certified means that the doctor is able to conduct impairment ratings, with slight exceptions for out-of-state doctors. These terms come from Rule 130.1, Certification of Maximum Medical Improvement and Evaluation of Permanent Impairment, along with Rule 180.23, the Division Required Training. So if a doctor is certified to assign impairment ratings, this is going to be reflected on their tax comp profile. And we went over that in one of our previous sessions. So just keep an eye out for that tax comp profile. If the doctor is certified to conduct impairment ratings, they have to meet certain criteria. They have to complete the required DWC training. And then, of course, they have to pass the required test at least once since May of 2013, or as requested by the division. So let's go through each of the doctor roles that we're going to see examples for today. First, we have our treating doctors. And of course, these doctors are primarily responsible for the efficient management of healthcare, also for coordinating the healthcare for the injured employees' compensable injury. And they might not be certified fully to conduct impairment rating exams, but they may certify that the injured employee has reached maximum medical improvement. So treating doctors may refer out to a certified doctor if an impairment evaluation, an impairment rating evaluation is required. So if the treating doctor thinks that the injured employee might have permanent impairment as a result of the injury and they're not certified, then they might need to find a doctor who is certified or authorized. And again, our tax comp system has that information about our healthcare providers. So that's going to include whether or not they are certified to do those MMI IR exams. So keep that in mind. And then our designated doctors, these are our specially trained doctors. They are selected by the Division of Workers' Compensation to resolve any questions or disputes about an injured employee's medical condition, the work-related injury or illness. And designated doctors can order testing from other healthcare providers to resolve those questions. Both designated doctors and RME doctors exams are ordered by the division, but there are some major differences. And that is that designated doctor reports have presumptive weight. And what that means is the results of that designated doctor exam, their findings, is going to be more significant if there was a dispute that came up and there were opinions out there from other doctors. That designated doctor is going to hold more presumptive weight. The RME doctor is basically the insurance carrier doctor who's authorized and able to conduct impairment ratings. This examination might come about in response to a request by the insurance carrier or even by the division. So RME doctors, they might also be asked to address or give their opinion on the appropriateness of the injured employee's health care. But again, most often, these requests are going to be from the insurance carrier following a designated doctor exam. So now we're going to review reimbursement for each doctor type. And here's those rules in a snapshot again. So be familiar with those. In 2024, there was a rule package that passed, and there was a one-time catch-up fee. So that MEI, you see up there, that one-time catch-up, since the fees hadn't been updated since 2008. Fees were increased around 28% by taking that MEI, that Medicare Economic Index, and applying it from the period of 2009 to 2024. So after 2024, those fees are going to be adjusted based on the MEI every year, and that happens in January. So the MEI, it's determined by the Center for Medicare and Medicaid Services on the price of the goods and services needed for you to operate your business. And you'll see in the note on this slide, if you look at the rule text, you're just going to see 2024 amounts in that rule. But just keep in mind, this has changed every year since 2024, and the division will continue to update these. And I'm going to show you, we do publish this information. So currently, this is what it looks like on our website. So you see that we have the conversion factor, the certifying doctor exam fees or DD exam fees. And then also there's going to be a few columns that are archived with the other information. And the oldest one will fall off as we update the most current year. You can find this table if you go to the division's website and look in that workers' compensation A through Z and click on C for conversion factor. Scroll down the page and you'll see all of these workers' compensation specific exam fees with their amounts published. So something in the rule that applies to most of your fees that we're talking about today is going to be rounding. So keep in mind, usually anything under 50 cents is going to be rounded down to the nearest dollar. Anything over 50 cents is going to be rounded up. Next, this section, the billing and reimbursement changes. These are found in 134-210E, medical fee guideline for workers' compensation specific service. Doctors, when they're billing for maximum medical improvement and impairment rating or other similar examinations, they must bill the MAR and be reimbursed the MAR. So discounts to workers' compensation, impairment rating fees for designated doctors, RME doctors, referral doctors, or treating doctors are not allowed. So no discounts, no discounts for certified workers' compensation network discounts. So just something to keep in mind as well. So now we're going to look at an MMI exam billing. And if a doctor has determined that maximum medical improvement has been reached for the injured employee, but there's no possibility of permanent impairment because that injury is sufficiently minor, usually this is a situation that would be handled by the treating doctor. And usually it's not going to rise to the level of needing an impairment rating by a doctor who's certified to do so. Only the MMI part of the exam is going to be billed if there's no impairment. Something to keep in mind as we go forward, 0% impairment is a different concept than no impairment. A 0% impairment rating would require a calculation, and that's going to require the doctor to use the AMA guides to permanent impairment. So again, that would require that doctor to be certified to issue a 0% impairment rating. So an exam with no impairment is a type of exam that, again, would probably be addressed by the treating doctor. And also the treating doctor can do that sort of exam by telemedicine or telehealth. So that next, we're going to have when a certifying doctor finds that the injured employee has reached that MMI, there is the possibility of permanent impairment. So in that case, they're going to bill for both maximum medical improvement, that portion of the exam, as well as the impairment rating portion of the exam, because it was conducted by a certified doctor. And this is going to be regardless of whether or not they use the range of motion model or the diagnosis related estimate in that exam to get that impairment. So the components of the exam, the maximum allowable reimbursement for MMI exams and impairment rating exams is equal to the reimbursement for both, again, the MMI part of the exam plus the impairment rating part of the exam. So that's going to be the maximum allowed reimbursement. And your total for the maximum allowable reimbursement is going to include the following components. So you have the examination, the actual physical examination of the injured employee, the consultation that you have with that injured employee, as well as your review of the records and the films. So you spend time on every one of these components, and your reimbursement should be reflective of that. Other components included in maximum medical improvement and impairment rating fees are the preparation and submission of reports. So that's also included. That includes the DWC Form 69, that very important form, the Report of Medical Evaluation, as well as the DWC Form 68, the Designated Doctor Exam Data Report. So these forms have not changed. They include the calculation tables, the figures, the worksheets, narrative reports, the tests that you conduct that are outlined in the AMA guides that were required for the exam. And keep in mind, if the AMA guides say that you need to do that test as part of the impairment evaluation for that injury or condition, then it's included in the MAR. So let's talk about billing and reimbursement for musculoskeletal body areas for an impairment rating exam. And MSK is short for musculoskeletal body areas. The certifying doctor may bill a maximum of 3 MSK body areas. So, of course, you have your spine. Spine and pelvis is one area. The upper extremity in the hands is the other. And then the lower extremity and the feet are the third. So, again, that maximum of 3 MSK body areas. Non-MSK body areas. So, obviously, it's not MSK, but all of your other body systems, your body structures. So it's going to include the skin, think mental and behavioral disorders. So you're going to be billing for each of those, and a complete list can be found in the AMA guidelines for permanent impairment. So there's chapters within the body system structures, mental behavioral disorders. Again, so if it's listed in the chapter, you can bill it as a non-MSK body area. Currently, we're using the 4th edition of the AMA guides, and you need to keep that in mind so that you can accurately bill. We've been looking at the exam. So after the exam, of course, you're going to prepare your report. Another form, the DWC Form 73, the Work Status Report, is a very important form you may be asked to address and relay your findings on. So this is the Work Status Report, and if you're conducting an exam that was ordered by the division, think our designated doctors, our RME doctors, you're not going to bill separately for this form. Written into Rule 134.2, I wanted to cover incentive payments for underserved areas in the workers' compensation system in Texas. This rule has a list of zip codes where the carrier is expected to add an additional 10% to the maximum allowable reimbursement if the doctor is conducting the exam in that area. So you're not adding this onto your bill, providers. The reimbursement is added by the carrier. It's important to understand if the doctor has a missed appointment, we now have a missed appointment fee. If it's in one of these areas, you're not going to get that extra 10%. The 10% is only going to apply to MMI, IR, and other similar exam bills. So let's start looking at examples for each doctor role. And we're going to start with designated doctors. And this is going to be outlined in Rule 134-240. So this outlines the rule for how to order designated doctor exams. So it describes the DD's role in assisting to resolve the disputes that we have come up. And designated doctors and identifying the bills that they must contain the DWC assignment number in the pre-authorization list. So I'm going to show you a little bit more about that assignment number. So one important aspect of it's going to be really important, an important aspect of your bill to have this assignment number on there. So again, it goes in the pre-authorization field. And this is what the top of the letter, the order, it's called the OA 32 letter that comes from the division. That's what this looks like. And you can find the DD assignment letter, assignment number right over here. I've blown it up there for you a little bit. And although it goes in the pre-authorization field, it is not a pre-authorization number because designated doctor exams and related testing or evaluations associated with DD exams do not require pre-authorization. So the number, it's 12 digits. And keep in mind, if you're referring out designated doctors to any healthcare provider, you need to send them this assignment number so that they can put it on their bill. And the carrier is going to know that that testing is related to that DD exam, didn't require pre-authorization, and they know it's associated with that exam. So the format of the assignment number, it's going to include the DWC number or the DWC claim number. That's the first 8 digits. And then the letters DD indicating that it is a designated doctor exam. And then the next 2 digits are the sequence number. So keep in mind, the DWC claim number is not the insurance carrier claim number. So they're 2 different numbers. One, the DWC tracks the claim with that number. The insurance carrier claim number, they have their own system for tracking that claim. So the DWC number plus DD, and then we have the sequence number because there are times that the injured employee may need to go back to that same DD, and you'll have a sequence 1, 2, or 3. And when it's required, any medical bill for designated doctor exams or related testing after June 1st of 2024 needs to have this assignment number on it. So even though it's been a while, we're still seeing this as a little bit of a problem. This number needs to be on the bills. So RME doctors, referral doctors don't need to use the assignment number. Again, it's only for designated doctor exams. So where does the assignment number go on the bill? Again, it must be listed in the prior authorization field. So on your CMS 1500, it's going to be in field 23, box 63 for your UBO4, like maybe the injured employee was sent out for an MRI. You need to make sure that that facility has that assignment number, right? This is a case where you would send them that assignment number and make sure they put it on their bill. Then your DWC 66, field 30. I can't imagine where we would see that form being used, but maybe. And then on box 2 of the dental form, we definitely have dental claims in the system. So if a carrier receives a designated doctor bill without an assignment number, they need to follow Rule 133-200 that says that they either need to fill in the blank for the healthcare provider or return the bill as incomplete. So we want that number to be in there so that you don't run into this problem. Next, we have the insurance carrier medical bill processing contact information. I've included this. This is a picture of the second page of the of that OA 32 order from the division, and it's going to have it's another place that you can find that DD assignment number. It's going to be right here at the top. Also, this block is going to include billing information for the insurance carrier. But a big note here, this information, please verify that it's correct, because sometimes we've seen that the information in this block is not correct. Somehow the wrong information got connected to the claim. So please verify. So the designated doctor billing deadline, it's going to apply to all healthcare providers in general, including designated doctors. So you must submit your medical bill within 95 days, no later than 95 days after the date of the exam. And this applies if no additional testing was done after the DD exam. And Rule 133.20B, it's going to outline the medical bill deadlines for healthcare providers. If you've been in the system a while, you might recognize some of these modifiers. These were deleted because they tended to cause confusion. Some of them were hardly ever used, but some of these, we're still seeing these. They should not have been used after June 1st of 2024. So if you have one of these on your bill, it might get denied, and then you wouldn't win if it went to medical fee dispute resolution if the carrier had used that as a defense for denying your bill. So please, please do not use these modifiers. These are the current modifiers that apply. NM is used to indicate that the injured employee is not at MMI. So V3 through V5, those are for our treating doctors only. So treating doctors only, V3 through V5, that's going to indicate the level of evaluation and management that corresponds to the impairment rating exam that you conducted. So VR, that is also for the treating doctor only. That stands for View Report, VR. And you're going to take a look at any different doctor's certification and then indicate whether you agree or disagree with their findings on the DWC Form 69. And now for our designated doctor only modifiers. Keep in mind, RME doctors, you do not use these W modifiers. These are DD only. So W5, MMI, IR, maximum medical improvement, impairment rating. For the impairment rating portion or the MMI portion, use W5. W6, that's for extent of injury questions. W7, disability exams. W8, maybe there's questions about whether this person can return to work. W9 is going to be for those other similar issues. So again, W modifiers, DD only. Then we have our MI. MI is for multiple impairment ratings. Again, designated doctor only. So this is when the designated doctor has been asked by the division to do multiple impairments. This request should only come from the Division of Workers' Compensation on something called a presiding officer directive or a POD. So it's an order. It's going to look similar to the DWC Form 32 that you're probably used to seeing, but this is coming from a hearing officer at the division. Again, please do not do multiple impairment ratings unless you are ordered or asked by the division and you have that POD in your hand. Then, of course, use that MI modifier to bill for your extra work. So here are two additional modifiers for designated doctors. Remember, DD only. 25 would be added when you're asked to do an examination of an injured employee that has one or more of the complex diagnoses listed in Rule 127, 130. For instance, maybe it's a vascular injury, traumatic brain injury, an infectious disease, or a spinal injury. 25 modifier will get the additional reimbursement of $300 for evaluating that complex condition. So 52 is the modifier for missed appointments for designated doctors. So this is when a designated doctor, maybe they've traveled to the far reaches of Texas, they waited at that exam site for at least 30 minutes after the scheduled appointment time, and then the person didn't show up. Again, all of this needs to be documented, that you stayed at the exam location for 30 minutes or more to support the charge for that missed appointment. And again, DD only. These are for DD only. So additionally, designated doctors may conduct MMI and impairment rating exams, of course. They can also conduct extent of injury, disability, return to work, as well as other similar issues to help resolve any of these disputes that came up on the claim. So I'm going to give you a scenario. Although it's pretty unlikely at the designated doctor level, but this would be for a designated doctor finding that an injured employee has not reached MMI yet. So you would bill using CPT code 99456 with that NM modifier. And reimbursement amount currently would be $478. So you would bill for the MAR, $478, and get paid the MAR, $478, just like we discussed earlier. If it's in one of the underserved areas of the state, the insurance carrier, they're going to get your bill, and they're going to add that extra 10% reimbursement. So also, you'll see an asterisk as we move along. You'll see that asterisk next to the dollar amounts because these could be adjusted annually based on the Medicare Economic Index. So keep that in mind as we're moving forward. This scenario is when the designated doctor examines the injured employee. They've reached maximum medical improvement, but there's no possibility of permanent impairment. This is, again, a significantly minor injury. And they would also bill the same. So 99456 with that W5 modifier, and $478 would be the amount for that exam. So looks the same as a previous example. This designated doctor did not conduct an impairment rating exam, so none is billed. Next, this is when a designated doctor examines someone who is at maximum medical improvement and they had an impairment rating calculated. This bill also 99456 with the W5 modifier. Reimbursement, again, $478, and also the impairment rating is going to be billed even if that calculation is 0. So for the impairment rating examination, in this example, this is going to involve, we're going to say, a musculoskeletal body area. So you're going to bill 99456 with W5. The units are going to reflect the number of MSK body areas. Remember, you could have a maximum of 3. But if it's for one, the first one is reimbursed at $409. Each additional body area would be $204. And again, regardless of whether or not you use the range of motion model or the DRE model to calculate that permanent impairment. So if the doctor calculates a non-MSK body area using the AMA guidelines, reimbursement for 99456, we're going to see that again, modifier W5, $204. And then there's no limit on the number of non-MSK body areas. However, you need to closely be following the AMA guidelines for the calculation of permanent impairment and those chapters that you're referring to for those non-MSK body areas. For tests that are outlined in the AMA guides, those are going to be included in the previous reimbursement, right? They're already included in the exam and the impairment rating. However, we realize sometimes tests that the designated doctor may conduct themselves may not be outlined in the AMA guides. So they would need to bill using the appropriate CPT code for that test. And then they're going to be reimbursed according to the DWC fee guidelines, in addition to the maximum medical improvement and impairment rating amounts for that exam. So this slide is going to outline when a designated doctor sends an injured employee out for testing. So Rule 127.10 says that the designated doctor must refer out for additional testing or evaluation when it's necessary to resolve the issue in question. So this is an instance when the designated doctor must provide the assignment number found on the order letter to the testing healthcare provider that they're referring out to. Pre-authorization from the insurance carrier, that's not required for the bill. Designated doctor or for the doctor who's going to be doing the testing or evaluation. So pre-authorization is waived and it's protected. The insurance carrier, they can't come back and deny the designated doctor ordered testing or evaluations for lack of medical necessity, extent of injury, or compensability, because those might be the questions we're trying to answer here. However, if you're the testing healthcare provider, absolutely continue to bill using proper billing and coding, because the carrier could still review the bill for that type of information, like correct coding, initiative edits, choosing the correct CPT code, also the documentation supporting your choice of that CPT code. So something else to keep in mind, designated doctors cannot be in the same network that covers the injured employee's claim. However, designated doctors can make referrals out to other testing healthcare providers regardless of their network affiliation. So, for those additional testing or evaluations, make your referral out to someone who's qualified that can conduct those tests for you and get you the information or the data that you need. So these healthcare providers, they can use the resource document that was attached to your login instructions for this webinar, but also it's on our on the DWC website, and that link is provided for you there. Send that document to the testing healthcare provider along with the assignment number, and then they must bill using the proper CPT codes, have that assignment number in the pre-authorization field, and attach the required documentation. So remember, reimbursement is going to be according to the applicable DWC fee guideline. And if it happens to be a provider in the injured employees network, they're going to get their network reimbursement. So if it's a referral to someone that is out of network, they'll get the Division of Workers' Compensation fee guideline amount. So here's an example of a CMS 1500, and this is the testing doctor, or maybe it's a hospital or some other clinic, like a physical therapy clinic. This is what it would look like in the middle portion of that CMS 1500. Field 19, this is a free text field, and you could absolutely put designated doctor referral in there. It's an optional field, but really what's going to be a big flag to the carrier that this is associated with that designated doctor exam is the DWC assignment number. And it should go again in that box 23. So let's look at other types of exam bills besides maximum medical improvement and impairment rating. The extent of injury exam is where the designated doctor has been asked to give their opinion on the extent of the compensable or the payable injury. They should bill 99456 W6, reimbursement of $682, and that amount is, of course, subject to change based on the MEI. Keep an eye out for those increases every January. And if the designated doctor conducts a disability examination, we would see 99456 with that W7 modifier. So reimbursement for the DD disability examination is $682. When a designated doctor is billing for a return to work exam, we're going to see CPT code 99456 with the W8 modifier. And again, that's $682 is the MAR, and it should be the reimbursement. And if you're used to seeing that work status report, usually that would be billed with 99080-73. This exam was for return to work. So that return to work form is already included in this. So if the issue and dispute is not covered in those first few examples, it could be one of those other similar issues that has come up on the claim that the designated doctor has been ordered, asked by the division to give their opinion on. So with that, again, we're going to see the 99456 with that W9 modifier. Reimbursement for that currently $682. So let's talk about designated doctor exams for certain diagnoses that are related to Rule 127.130. On the DWC 32, you'll see where the conditions are checked. You'll see those more complex conditions checked off. So the designated doctor needs to meet certain criteria of their qualifications to even take on that sort of exam, of that complex diagnosis that they've been assigned. In that case, no matter what the outcome of the MMI and the impairment rating, you would still get that $319, and you would bill that with that 99456, 25 as the modifier, again, for that $319 fee. And it's a one-time fee, no matter if they had 3 or 4 of those special conditions that you're addressing on that same day. The special diagnosis list is going to be, you can find that in 127.130. So if the division asks the designated doctor to complete multiple impairments on one of those special orders called a presiding officer directive or a POD, that would be billed using 99456 W5, and then you're also going to add MI for the modifier. So you'll have W5 modifier and MI modifier. For the number of units of this charge, it's going to be the number of additional impairment ratings, and then the reimbursement for each additional impairment rating calculation is going to be $68. And again, even that fee is subject to increase based on the MEI every year. Now we're looking at the designated doctor missed appointment fee. Again, designated doctor only. So sorry, RME doctors, treating doctors, referred doctors, this is not for you. Designated doctors. This is when the injured employee does not attend their properly scheduled or rescheduled examination, and the designated doctor, you've waited at that location for at least 30 minutes. You need to document that you did wait and that the exam was properly scheduled. If you want to know what properly scheduled means, Rule 127.5 lines that out. Designated doctors, you should bill the that missed appointment fee with 99456, and then that special modifier 52. Reimbursement for that is going to be $107. Even if you're out in the far reaches of Texas, this charge is not going to qualify for that additional 10% incentive pay for underserved areas. So just keep that in mind. So here's some concrete billing examples for designated doctors. This is an example of a bill where the injured employee has a lumbar strain for several disputed issues. The order said we're to address MMI, impairment rating, extent of injury, and return to work. So lots of questions about this injured employee. The designated doctor has chosen to use the range of motion model to evaluate that one body area. So MMI, again, we see that 99456 all the way down, but then for the different issues, we've just adjusted the modifier. And then your fees are listed over here. The total for this bill will be $2,251. And again, the fees that we've listed here are 2026 rates. Something else to keep in mind as we're moving forward. The rule does not specify whether you bill the whole exam on one line or whether you break out each individual item. But if the carrier, if you build it all on one line and then the carrier turns around and asks you to itemize it out or vice versa, if you can do it within your 95 days, go ahead and do it, right? To kind of work on getting that reimbursement faster. On the front end, best practices show to go ahead and just itemize everything out. That way you can easily look back and say, oh yeah, I charged this for this for that. Especially if you have issues or disputes on down the road and you need to go back and see exactly what you did. It's probably going to be easier if you itemize it out, but keep that 95 days to submit your bill in mind. Let's see, example 2. This injured employee, we're going to say, has a lumbar as well as a foot and a leg injury. And we've been asked to look at MMI, impairment rating, and then we see that second area, that second MSK body area. The designated doctor has chosen to use the diagnosis-related estimate, but again, that doesn't matter. So they're going to evaluate and do a second impairment rating calculation. And also, remember, we needed to have a pod, right? We should have had a pod ordering us to do this second evaluation. So maybe they're going to include the spine and exclude the lower extremity. And then the second one, they want all of those body areas. So just keep in mind, you're going to see 99456, our code with our different modifiers. And then this one, you have that multiple impairment modifier. So it's going to be very important. Here's your reimbursement rates. The first body area, 409.00, and then $204 for that second body area for the impairment rating. So that's where those numbers come from. And then your multiple impairment rating for that additional body area, $68. And then the extent of injury exam is billed at $682. So the total on that exam would be $1,841 MAR, and should be paid the MAR. And then this is an example of how it would look if you did not order testing or if it was done on the same day. This is the CMS 1500. You're going to have the date of the exam in the 2 column. And then in the 2 column. And then January 8th is the date the exam occurred. And then January 8th also happens to be the two, so it's in the to column and the from column. So everything happened on that day. And again, 95 days from that day to get your bill in. Next example is an injured employee with a lumbar strain, low leg injury. We have maximum medical improvement, extended injury, return to work. So designated doctor chose to use the DRE method to evaluate the spine and range of motion for the lower leg. So two different ways to evaluate the impairment rating, but the bill stays the same. Maximum medical improvement all the way down. We're going to use 99456 as our CPT code. Again, we're just changing the modifier based on the issue that was requested. So $478. We have our two body areas on the impairment rating. And our total for this exam, 682 for the EOI, extent of injury and return to work. So 2,455 is the total for this bill. So in the example where a designated doctor has sent out the injured employee for additional testing, the from and the to dates are going to matter because the to date is going to be the date of the last test that the designated doctor ordered that was completed, that was done. So this example, I'm going to show you what it looks like. So the injured employee was examined with a spinal cord. They had a spinal cord injury, and we were requested to evaluate maximum medical improvement, impairment rating, extent of injury, and return to work. So the designated doctor used let's just say that they used the range of motion model. But again, they could use either one for the impairment rating. The designated doctor sends out the injured employee for additional testing. So the exam originally happened on 1/15. The additional testing happened on 2/4, February 4th. So the from date is the date of the examination. The to date is the date of the testing, not when you got the report. Your 95 days begins using that February 4th date, right? The date of the additional testing. And then also on this bill, we see that this is a complex diagnosis. So this is a spinal injury. So the DD is going to bill 99456, our W5 for maximum medical improvement, and then that complex specialty fee, and that is going to add $319 to the maximum medical improvement fee. And then the impairment rating was just for one body area. So that's our 99456 W5 modifier. And then on down for our extent of injury and return to work. The total on this bill, $2,570. And again, these are all 2026 updated fees for you. And this is what it would look like on the bill. The date of the designated doctor exam is the from date, and the to date is the date of the test when that happened. Again, it's not the date that you got the report, because that may be a lot later. So in this example, they conducted the DD exam on 1/8/26, and then it went to 2/19 because that was the date of the test. So this was an ongoing issue for many years where testing would be conducted and it would just be weeks or months later that the designated doctor would get the report. So just keep in mind, it's the date of the testing. The last billing example for the designated doctor is that missed appointment fee. So DD, again, they've been ordered to evaluate this injured employee with a foot and a leg injury for maximum medical improvement and impairment rating. They traveled to the exam site. They waited 40 minutes. Still no injured employee. So the designated doctor, they're going to document what happened and bill using 99456 with that 52 modifier for a total of $107. All right. So thank you, designated doctors. Now we're going to take off that hat and we're going to put on our RME doctor hat, required medical exam doctors. We have doctors in our system that fill all of these roles. They could be a DD and an RME. They could be a treating doctor. They could be, have all of these roles. So it's important to keep whatever role in mind so that you can apply the appropriate rule to their billing. So RME exams, they're performed in accordance with the labor code in these sections and according to our specific rules, 134.235. And these, again, this is going to be in order in response to a request from the insurance carrier or the DWC. Types of RME exams that can be done are similar to designated doctor. So you can have MMI, impairment rating, extent of injury, disability, return to work, other similar issues. The last one, though, this is an exception. So appropriateness of healthcare is something special that RME doctors, required medical exam doctors, can examine for that designated doctors can't. Only RME doctors that are certified to calculate impairment ratings can take RME exams. And again, it's billed like designated doctors with some exceptions. I'm going to show those to you. So the exceptions are that they're not going to use those W modifiers, right? RMEs have strict CPT codes, very few modifiers. There's no extra reimbursement if they get assigned one of those injured employees that has a complex diagnosis listed in 127.130, like the designated doctors do. And then also no extra payment if they conduct multiple impairment ratings. They're not going to use that MI modifier. So RME doctors are not going to be receiving pods from the division. Those are only for designated doctors. So if the carrier asks for multiple impairment ratings, and there's many circumstances that they will ask that of the RME doctor, there's no additional reimbursement for that. Also, there's no missed appointment fees for RME doctors, even though they may travel. And then also, they don't have to bill with an assignment number. So you're not going to receive an assignment number on the order. Those are only for designated doctor exams. So we're going to go through each scenario just like we did with the designated doctor. And this first one, if they examine the injured employee, determine they're not at MMI, they're going to bill, again, 99456, our good friend, and they're going to use that NM modifier, reimbursement amount, $478. And this example has where the RME doctor determines that someone's at maximum medical improvement with no impairment. The RME doctor, they need to bill 99456, be reimbursed that 2026 rate, in this example, $478 for that MMI evaluation. This example where the RME doctor determines someone is at maximum medical improvement, they conduct an impairment rating examination because there was possibility of impairment. So they're going to go through the calculations. Even if it turns out to be 0%, that's a calculation that needed to happen, and the impairment rating exam has occurred. The RME doctor, they're going to bill 99456 and bill using $478 for that amount and be reimbursed that amount. So now MSK body areas, again, we see CPT code 99456. The units is going to reflect the number of MSK body areas up to 3. And again, reimbursement at $409. And then each additional area would be reimbursed at $204 a piece. So MSK body areas, regardless of which method they use to calculate the permanent impairment. So range of motion or diagnosis related estimate, doesn't matter. So non-MSK body areas, again, found in the AMA guides, you're going to refer to that. Each non-MSK body area, there's no limit on the number of units. So 99456, and each would be billed at $204, and each area reimbursed at $204. Next, if you're going to conduct testing as an RME doctor, that is not outlined in the AMA guides as part of that impairment rating evaluation, you're going to bill the appropriate CPT code for that test, and you're going to get reimbursed according to the applicable fee guidelines, in addition to what you billed for the MMI examination and the impairment rating examination. But remember, if it's called for in the AMA guides as included in the exam for that type of injury or condition, it would be included in your previous MAR. Extent of injury exam conducted by RME doctors, giving their opinion on extent of injury, 99456, no modifiers, and $682 is the MAR, and what you should charge and what you should get reimbursed. And take a note here, your documentation needs to support the examination that you conducted, whether you're billing any CPT code. Your documentation needs to outline what you did. So we do have a boot camp presentation about documentation. So be sure and check that out. Also, if your RME doctor is conducting a return to work evaluation and you're billing 99456, you're going to be getting $682 for reimbursement. You're not billing separate for that work status report. It is included in reimbursement for that exam. Other similar issues, same thing, we're seeing CPT code 99456 with $682 for reimbursement. And make sure your documentation is clear so that those disputed issues can be resolved with your opinion and your charges can be supported. And next is if you're being asked to do an appropriateness of care examination by the insurance carrier, you bill 99456, and reimbursement for that would be $682. So if the RME decides that they need to send the injured employee out for testing, so for instance, maybe they've never had a functional capacity evaluation or something else related to a return to work exam, you could do that. But it's not going to have the protections of Rule 127.10, like the designated doctor situation. So the referred testing, the evaluation healthcare provider needs to bill the appropriate CPT codes for the test that they're doing. Attach the required documentation, including your referral and reimbursement, is going to be according to the DWC medical fee guidelines. So the carriers, they can review for all of their defenses like compensability, medical necessity, and then also the assignment number. This doesn't come into play because, again, this is an RME exam and not a designated doctor exam. So a few examples. If you're still carrying these slides around in 2028 or beyond, know that these amounts can and will change, probably, most likely, according to the MEI. So this is an injured employee, lumbar sprain strain. We're asked to evaluate MMI, impairment rating, extent of injury, and return to work. So 99456 all the way down, units 1, and then our applicable fees, 478 MMI, 409 for impairment rating, 682 for extent of injury, and 682 for return to work. That would be $2,251 for that RME doctor's reimbursement. Example 2, this injured employee has, again, lumbar sprain strain. RME doctor is doing MMI and impairment rating, extent of injury, and return to work exam. Range of motion method was used to assess impairment rating. They're going to provide a total of 2 calculations in the impairment rating because the carrier wants to know. Impairment rating is only for one body area. And remember, even though they did multiple impairment ratings, they're not going to get reimbursed for that as an RME doctor. So there's no extra lines for multiple impairment calculation or a modifier. So this extent of injury is 99456, reimbursed at $682, along with return to work at $682, would be a total of $2,251 for that exam. And then this one is where the RME doctor evaluates patient and they are not at MMI. You should still be using that 99456 and then use that NM modifier. You can use that one. Reimbursement at $478, whether or not they're at MMI or not. All right, this is a sprained strain, lower leg injury, MMI, impairment rating, extent of injury. The RME doctor used range of motion. And then we have 2 body areas. Be sure and note your body areas. 99456 is the CPT code all the way down, and then our applicable reimbursement. The breakdown is for the 2 body areas. The first body area, $409. Second body area, $204. Total on that bill, $2,455. Now, thank you, RME doctors. Put on your treating doctor hats. Treating doctors, you're going to look at Rule 134-250, specifically addresses your MMI and impairment rating evaluations. Again, treating doctors, you must be authorized to conduct maximum medical improvement and impairment ratings. If you're doing an exam for MMI only and there's no possibility of impairment, that's okay if you're not going to do the impairment rating evaluation. But if you are doing impairment rating evaluations, even if it's 0%, you do need to be certified or authorized to conduct that exam. You can't use the AMA guides to permanent impairment unless you are certified to conduct an impairment rating exam. So this scenario, similar to the other doctor roles, when your patient is not at MMI, you conduct the exam and you're going to bill $99455. This is a workers' compensation specific exam. And then you're going to choose the level of evaluation and management code that corresponds. So if it's 99213, use the V3. 99214 level, use V4, and so on. And again, this is based on the amount of time that you needed or your medical decision making. So if your treating doctor evaluates the patient and they're at maximum medical improvement with no possibility of impairment, and of course, that's the treating doctor's role. We want them to do this type of exam. They're in the best position to know whether or not this person is as good as they're going to get medically from this injury. So with the treating doctor's determination that they're at maximum medical improvement with no possibility of impairment, you would bill 90455, again with that appropriate V code. And then you're going to be reimbursed according to the medical fee guideline for that corresponding office visit level. And also a note here, the way that we were rounding up and down on the previous examples, treating doctors, the rounding does not apply to you. So keep that in mind. Just the dollar amount's the dollar amount. Cents amount is a cents amount. So when a treating doctor determines that someone is at maximum medical improvement, certified to do impairment ratings, they must bill for maximum medical improvement and the impairment rating. So MMI is going to be 99455 with that appropriate modifier, V3 through V5, and then reimbursements according to the medical fee guideline. And then the impairment rating portion would also be billed, and you would have to be certified. And that also would be billed at 99455. Your units are going to reflect the number of body areas. If it's MSK, it's going to be up to 3 body areas, so $409 for the first MSK body area, and then $204 for subsequent ones. These are not subject to discounts. So this is the full MAR amount with the maximum of 3 body areas, and that is the amount that should be paid. When a treating doctor performs an impairment rating for each non-MSK body area, again, those can be found. Currently, we're using the 4th edition of the AMA guides. You need to look there. The CPT code is 99455, and you're going to get units for the number of non-MSK body areas, and those would be reimbursed at $204 each. So remember, if the testing is outlined in the AMA as part of the exam for that condition or injury, you do not get extra reimbursement. If it is not included by the AMA, like we've seen in the other examples, the treating doctor, they decide there needs to be some additional tests, need to bill that, and the treating doctor conducts the test themselves, use the appropriate CPT code for the test, document, and it'll be reimbursed according to the applicable fee guidelines, in addition to the impairment rating or the MMI examination fees. Treating doctors, this is unique to you because you're in charge of coordinating all the care for that injured employee. You might receive a DWC 69 form from another doctor certifying this person is at MMI and they've assigned an impairment rating. Hopefully you would have done this first, but if not, you might receive this and review it and then indicate whether you agree or disagree. For the review of that report, that certification, you would bill 99455 with the VR modifier. Reimbursement would be at $66. So, treating doctor billing examples. This example is when you've examined the injured employee, non-network injury. Location is in Austin, Texas. We've included the location in this because it matters, because we're using the medical fee guideline here, lumbar sprain strain with a complexity associated to CPT code 99213. So the treating doctor determines the injured employee's reached MMI, but there's no permanent impairment, no possibility of permanent impairment. The code would be 99455 using that V3 modifier because it's related to 99213 CPT code. So you go out, calculate how much someone would get paid for 99213 in your area. In this example, we used the calculation for Austin, Texas. And remember, rounding is not going to apply to you treating doctors. So a non-network claim is in this example. If it was a network claim, you would just go to your network contract amount. In this example, reimbursement is approximately 217% of what Medicare pays for 99213 in Austin, Texas for a non-network injury for a treating doctor who is authorized for maximum medical improvement. In this example, the treating doctor is going to determine that they are at maximum medical improvement, they have permanent impairment, and the authorized certified treating doctor conducts that impairment rating. So they're certified, they are authorized to conduct that impairment rating. They're going to use the range of motion model for that musculoskeletal body area, let's say, to the spine. They're going to bill 99455 using that V4 modifier. Modifiers related to that 99214 CPT code for the complexity or the time spent on that exam. So calculated out for a non-network injury for someone in Austin. The exam was in Austin, Texas, and it's going to be $300.41 approximately. And the impairment rating portion of the bill would be one body area for $409. So that's a DWC workers' comp specific fee. So $409. The total for this bill for the treating doctor would be $709.41. Last doctor roll, take off treating doctor hat, quickly put on our referred doctor hats. The referred doctor, this is for those doctors that the treating doctor is not fully authorized or certified to conduct an impairment rating. So this will be, they got referred out to this doctor who is certified. They are authorized. They can conduct impairment ratings. So if you have on your referred doctor hat or RD, they're going to have their own rule, 134-260. So this is one that the treating doctor refers to, authorized according to Chapter 130 and Rule 180.23 to conduct both impairment rating exams and maximum medical improvement evaluations. So this example, the referred doctor examines the injured employee. They're not at maximum medical improvement. So they're billing 99456 NM, not at MMI, and then reimbursement would be at $478. This case, they're going, they determined that they are at MMI and there is no permanent impairment, and there's no possibility of permanent impairment. Injury is sufficiently minor. So again, we see 99456, and then the reimbursement rate for this is $478. They don't need to conduct the impairment rating exam because, again, the doctor determined there's no possibility of permanent impairment. So if the referred doctor does conduct the maximum medical improvement evaluation, they are at MMI, there is the possibility of permanent impairment, they're going to conduct the impairment rating exam too. They're going to start by billing the MMI part at 99456. And then for the impairment rating part on that same bill, if they're doing an MSK body area, they would use 99456. So the number of units are going to reflect the number of body areas up to 3 for a musculoskeletal exam. So the first one is reimbursed at $409, and then the next two are reimbursed at $204 a piece. So each non-MSK area for referred doctor doing the examination, there's no maximum number of units there, same as our other doctor roles. So you're going to be getting 100% of that $204 for each non-MSK area that you did the impairment rating evaluation on. So with the AMA guides, again, call for the test that's included in your reimbursement. If it's not outlined in the AMA guides and the referred doctor is going to conduct the test themselves, bill using that appropriate CPT code for that test, and then be reimbursed according to the applicable DWC fee guideline, in addition to other examination costs, and documents. So, referred doctor bill example. The doctor examines, determines the injured employee is not at maximum medical improvement. So you're going to use the NM modifier with 99456. 1 unit, $478 would be your reimbursement. This example, lumbar sprain and strain, injury to the lower legs. So now we have 2 MSK body areas for maximum medical improvement and impairment rating. The referred doctor, they can use range of motion to assess the impairment rating to both areas. So maximum medical improvement, 99456, reimbursed at $478. And then we have our two body areas. And again, we see $409 for the first body area, $204 for the second. Total for this referred doctor evaluations, $1,091. And that's it. So we've gone through all of our doctor roles. I just want to quickly show you, we have all of our designated doctor resources on our designated doctor webpage. You would select the workers' compensation tab at the top, and then you'll see healthcare provider tab, and then click on that. And we have all sorts of information for our designated doctors and certifying doctors. Here are some additional links with email boxes that are there to assist you with any of the issues you have regarding your exams, designated doctors. So to recap, we went over the rules, reimbursement values, billing requirements for each doctor role, billing instructions and examples. You were very patient, thank you. And then our DWC resources. Thank you so much for your attention and for attending today's webinar. If you have any questions that come up after you leave here today, please reach out to Comp Connection. You can call us, you can email us. We are here for you. So let us know any questions that you have, any way we can help. Thank you for attending and for watching this video today.